Okay, good morning everyone, and thank you for being here, and thank you really for doing the service to the community who wants to hear what is going on. The way I see the agenda today, I will make a few summary comments and then introduce the speakers. At the end, I will also provide a summary of the cases because that will be the opportunity for us to meet this week. And then we will open it up for questions at the end so that we are not going down a path in the beginning. So I want to start out and just remind all of you and remind the community that I did go before the Board of Health at the beginning of this week and actually presented to them a rationale for the implementation of a mask mandate. And as you know, the Board of Health supported a mask mandate. Since then, I have received letters of support from Omaha Medical Society, the Charles Stewart Health Center, One World, Latino Center for the Midland, Health Ministries of North Omaha Churches, Empowerment Network, Nebraska State Education Association, the Heartland Workers Center, the New Era Baptist State Convention of Nebraska, and the Greater Omaha Chamber. However, in the last few days, there has been some legal disagreement between the Attorney General's office and the city attorneys regarding the authority of the local health director to issue a mask mandate for the city of Omaha. I thought about this long and hard. However, I do not think that at this time, therefore, I will pursue a mandate for mask wearing. The mayor will discuss potentially some action that the city council could take, but I let the mayor talk about that. But at the same time, we are all here together today to really underline why it is important to wear masks. This will slow the spread of COVID-19. And I think we need to get, hopefully we can get this really into the public health arena. This is public health. And these experts are going to be able to share with us what is the science behind it. And so I'm really happy to see those individuals come forward today. But also at the same time, I want again to stress the need and the importance of wearing a mask. Please, everyone in this city, in this county, do the right thing. I've heard a lot about liberty over the last few days. But liberty also requires responsibility. And that is what I hope everybody takes into account. As a health director, I will continue to look at the data every day, share with you and the community where we are at in regards to cases, positivity. But for now, I have to trust everybody in this community to do the right thing and moving ahead. Please protect your family. Think of yourself when you are wearing a mask. Think of your neighbor. Think of the person next to you and do the right thing. Wear a mask when you are in public and cannot social distance. So I think now I would like to introduce Dr. Anton. Dr. Anton is the Chief Medical Officer, and he's also representing the Governor's Office today. Dr. Anton?
Well, I want to thank Dr. Poor for inviting me today and to specifically thank her and all the other local public health departments and directors throughout our state for their hard work, and we have been working hard over the last several months, for their expertise and their leadership. Specifically, Dr. Poor truly epitomizes what a public servant is and what a public health expert is. As a doctor for almost 40 years, I cared for one patient at a time. I can't imagine how it feels to care for 500,000 people at a time. Several months ago, right here in this room, I believe, we announced our first case of COVID-19. And at that time, we stressed the importance of non-pharmaceutical interventions. That was our only way to slow the spread of the virus. There was no vaccine and no one was immune. If you remember, we did elbow bumps and coughed into our antecubital areas. This past April, the governor announced a 21 stay-home campaign. And Nebraskans did the right thing. And we did flatten the curve. We preserved our health care capacity, and anyone that needed a hospital bed, an ICU room or ICU care, or a ventilator was able to get one. Today, these non-pharmaceutical interventions are our mainstays still of preventing the spread of the virus. However, they have evolved over time, over the last several months, into what you can summarize as the 3 W's. And the first and foremost of those 3 W's is wearing a mask. We know the importance of protecting yourself and others when you wear a mask. And we will continue to stress that at the state level. The second one is to watch your distance, to maintain that social distancing. And if that is not possible, to wear a mask. And we're going to continue to stress that also. And the third is to wash your hands frequently. Now the governor, our Department of Health and Human Services, the local health departments, and all other partners throughout the state will continue to actively promote the benefits of wearing a mask and following the 3 W's above. We know that Nebraskans will again step up and do the right thing like they did in the past. And together, as Nebraskans, we'll beat this virus. I want to thank Dr. Poore for allowing me to be here today, and I'll turn it over to the mayor.
Thank you, Dr. Antone, and I want to take this off to speak to you this morning. Over the last 5 months, I have lost count of how many press conferences that Dr. Poore and I have had together to help Omaha citizens navigate through this pandemic. We wanted to keep you informed, we wanted to give you the data, and we wanted to give you our best advice that we possibly can. We have said from the very beginning how important wearing masks are in public, how important the hand washing is, and how important social distancing is. And we still feel the same. As time goes on, I think we get more and more information from our experts saying that wearing a mask is very, very important, and it will help control the spread of COVID-19. We know that. It's a simple request we want to make to every citizen in Omaha. Please wear your mask when you are out in public. I have great concerns as school starts, as do all the area superintendents. I talk to them frequently. They have plan A, B, C, and D now, and probably a lot more, just not knowing what is going to happen when school starts. And I think the mask wearing is critical for that. Since Dr. Poore has made the decision to not do a mandate, here is what I would like to do. I've already talked to the president of the city council. I've asked our law department to draft a resolution, and that is non-binding by law, but it makes a strong statement to get on the next city council agenda and let all 7 city council members, as well as myself, send this statement out to the community and say, we strongly support everyone wearing a mask in public places. One of the other options the city council has, and I've talked to Councilman Jerem, who's the president, about this, is as recent as this morning, is they could do a city ordinance, but we thought about it, and if they did do a city ordinance, of course that would be enforceable by law, but it would also take 3 readings. Next city council meeting is on August 11th. It would take 3 meetings and a second reading of public testimony, and then the law would go into effect 15 days after the 3rd reading. That gets us to about mid-September. And so I'm worried about the timing with that, although that is something the city council could still do. In my opinion, we all should have been wearing masks a week ago. So I worry about the ordinance taking so long. Now, I want to say this to a lot of my constituents. We get probably 1,000 calls or emails a day, and everybody has an opinion. Everybody has an opinion about COVID. Everybody has opinion about masks. But the one thing I hear the most is, you're taking away my freedoms. You're taking away my rights. You should not be able to tell me what to do. I have rights. There is a Constitution, and you are absolutely right, there is. But the Constitution is not absolute. And in times of war and in times of pandemics and epidemics, it does give government the authority to make some pretty strict changes for the health and safety of all of our citizens. And that's what we are doing now. Yes, you have lost some of your freedoms, but the great thing about this country and our Constitution is you will get those back. And I will guarantee every citizen in Omaha that I will fight to the nth degree to make sure that all of those freedoms are given back to you. But at this time, we are pleading with every citizen in Omaha. We are asking them to wear the mask while they are out in public places, and help us navigate all of you through this pandemic. And hopefully within a few months, we will get a lot better news. But right now, we really, really need to be responsible and do the right thing. I want to end with saying we could not be Omahans in a better place than we are right now with the expertise that you have standing in front of you today. Dr. Poor, Dr. Antone, Dr. Rupp, Dr. Lowe, Dr. Niemann are all here today, and they're going to speak to you. They are the experts, and they're here right in Omaha. So I'm asking you all to listen to them and to listen to what they say. They know what they're talking about. This is not a political issue. This is a health and safety issue. And we will take care of everybody in Omaha. We just need you to help us navigate through this. So thank you all.
Thank you, Mayor. And now I would like to introduce Dr. Carley Niemann. Dr. Niemann is our medical advisor for the Douglas County Health Department. She also is an adult and pediatric infectious disease doc and sees patients at Children and at Nebraska Medicine. So Dr. Niemann, please.
Right. Good morning, and thank you, Dr. Poor and Mayor Stothert, for inviting me. So as Dr. Poor said, I've had the opportunity to work with both children and adults over the last few months infected with this virus, and have seen what it can do. And while children, for the most part, tolerate this virus very, very well, they're either asymptomatic or have mild symptoms, there are those children that get sick and who require admission to the hospital. In addition to just the acute infection, there is also the multi-system inflammatory syndrome, which can affect children weeks after they've been infected, which results in multi-organ dysfunction and does require hospitalization. Over the past 2 weeks at Children's Hospital, we have noticed an uptake in the number of admissions of pediatric patients with acute COVID infection. 2 that I was recently involved with presented with acute respiratory distress. 1 required to be placed on a ventilator and admission to our pediatric intensive care unit. The families of these patients had been doing everything right. They had been social distancing their kids. They hadn't been out of the house in months. They hadn't allowed sick people into their homes. But parents have to go to work, and occasional extended family member who appeared well visited. These children got this virus by someone in the community shedding it asymptomatically. Our community failed these families. We can make this better if we all do the directed health measures of masking, washing hands, and keeping the social distance. Mask work. My mask protects you. Your mask protects me. And we are having more and more evidence that this works. One great example is a recent Morbidity and Mortality Weekly report from the CDC, which described in Missouri 2 hairstylists that were practicing while they were both had active symptoms of COVID infection. And despite them having active symptoms, they worked with 139 different clients. Of those 139, none acquired the infection and became sick. That happened because both the stylist and the client were either wearing a medical mask or a cloth mask. The transmission that occurred was from stylist 1 to 2 when they took their mask off in the break room, and from some close family contacts. We also have lots of engineers looking at this. And we know that when we speak or cough, our respiratory droplets go in front of us and are expelled, and the CDC recommends that 6 feet of distance. When we look at the different types of masks people are now using, when we look at a bandana that can flap, that distance can go down to about 3.5 feet of droplets. When we have a stitched 2-ply cotton mask, that distance goes down to 2.5 inches. That's pretty impressive. So masks work, and we need to do masks. In 2 weeks, we hope, 2-3 weeks, we hope to open our schools. And we're asking thousands of students and teachers and support staff to come back into an environment that we have been telling people to avoid for months. Large groups of people in an enclosed space. To do that safely, we need to get our community transmission down. While I said, again, kids for the most part tolerate this virus well, some do get sick. But we have teachers, support staff, our mothers, our fathers, our sisters, our grandparents that are going to be in this environment, and they are going to be at risk from age alone and other comorbidities to have more severe disease. We need to protect them. We want, when schools open, that they stay open, that we don't need to close them down. I'm a working mom. I have a 4-year-old son currently at home in quarantine because he was exposed to COVID infection in his daycare. Our community failed him, and it failed his classmates. Going forward, we need to think more about those more vulnerable people in our population and put them in front of ourselves. I like to think of masks like seatbelts and car seats. In the not too distant past, they were not standard on cars. And when a lot of us in this room were young, we probably were not restrained appropriately. But we learned over time the benefit they have to society, and now they are standard. Over the last several months, we've learned a lot about this virus. We are learning how it's transmitted. We are learning how to prevent that transmission. And we know when we do the directed health measures, the mask, the distancing, the hand hygiene, that we decrease transmission. So I would ask our community to step up, do your civic responsibility so that we can put children and those immunocompromised, elderly, frail ahead of ourselves for the good of all. Thank you.
And now I would like to introduce Dr. Mark Rupp. Many of you have seen what a great communicator he is, really presenting data for us all, and we all are used to really listen to his advice in this community. Dr. Rupp, please.
Dr. Poor, thank you very much for giving me this opportunity to speak this morning. As was related, my name is Mark Rupp. I'm a professor and chief of the Division of Infectious Diseases at the Nebraska Medical Center. Personally, I'm very disappointed that we are not here before you to announce a masking mandate for Omaha and Douglas County. I'm frustrated that as a community we could not find a way to surmount perceived political threats, potential legal challenges, or logistical hurdles to mandate mask usage in our locality. Therefore, it is incumbent upon each of us to do the right thing, to show personal responsibility, and to wear a cloth face covering or face mask whenever we cannot maintain a safe minimal distance from one another or when we are in an indoor shared air environment. Now, I'll be the first to admit, face masks are not a perfect defense, and their utility depends on the filtering capacity of the materials from which they are constructed and how tightly they fit to the face. However, they do offer some protection, and some protection is better than no protection. As Dr. Niemann has just related, they are effective in containing secretions. They are effective in preventing the transmission of COVID-19. They do filter some proportion of infectious droplets and protect the wearer. Also, they help to contain respiratory droplets and secretions that all of us generate when we breathe, when we talk, when we sing, when we cough, when we sneeze. Masks serve as a strong reminder to all of us, a visual clue that we are in the midst of an unprecedented pandemic and that we need to socially distance and that we need to practice good hand hygiene. Face masks remind us to avoid touching our face and to avoid inoculating the virus to our eyes, our mouth, our nose, and potentially infecting ourselves. Unfortunately, mask wearing has degenerated into a divisive and political issue. This is faulty thinking. Wearing a mask is simply a common sense public health intervention to keep us healthy. The coronavirus is completely non-discriminatory. It does not care what your political persuasion is or what your religious beliefs are. It does not care if you are a sinner or a saint. Anywhere non-immune human beings gather in proximity to one another, it will prey. Please help to protect yourself and those around you. Wear a mask when you are in any public indoor shared airspace and when a safe minimal physical distance cannot be maintained. Thank you.
Thank you, Dr. Rupp. And now I would like Dr. Lowe come forward. Dr. Lowe really has experience in regards to environmental health issues. He has looked at many cases. He is an author of some of the new studies that have come out on aerosolization of COVID-19. So I think he is the perfect person to actually close up these discussions. Dr. Lowe, please.
You bet. Thanks, Dr. Poor and Mayor. You know, a lot of great comments have been made, so I just want to add a little bit more context and experience from our perspective. So we just released 2 studies, one that was reported in Nature Scientific Reports that characterized infectious coronavirus in air samples. Those air samples were collected with people that were mildly symptomatic or asymptomatic, no symptoms whatsoever. And what those studies showed was that coughing or even talking result in virus being expelled by an infected individual. So as others have mentioned, we see a significant number of people in our community and around the world who are infected and have no visible signs that they're infected. And our studies show that talking and coughing and other verbal activities are fairly efficient at putting virus out into the air and exposing others. What's important to note is that we've taught for years, and it's been widely adopted, to cover our mouths when we cough. With this new information about coronavirus, we see the added value in covering your mouth and nose while you're talking, even when you may not know that you're infected. This becomes an important consideration when we're indoors and when we're with a number of people. As has already been said by my colleagues, masks are no silver bullet. They're a valuable intervention on top of social distancing. So when we are indoors with a lot of people, distance and masks are very effective. Masks capture about 60 to 70% of the particles, infectious particles, that an infected person puts out. This can be the difference between being infected and not being infected. Our team operates in the most high-risk environments. From February, taking the first patients off of airplanes and bringing them into the quarantine unit, to going into meatpacking plants with outbreaks or nursing homes with outbreaks, our team wears masks, and we have not had one infection. no infection during exposures in those high-risk environments, and no infection amongst our team from asymptomatic individuals. We wear masks in meetings. So with this, I just want to leave you that we have a calling as a community during this extraordinary time of a global pandemic to think about our community, to think about those most vulnerable in our community, and to take measures as individuals to protect those. So I leave you with two considerations. One is we are all totally committed to getting our schools reopened and getting kids and teachers back in schools. This is going to require a community effort to control coronavirus. The other kind of silent issue that is gone widely unnoticed is that we have members of our community in nursing homes that have been in their rooms since February and will remain there until we get this pandemic under control. This is one of the things that I think requires that resolve from our community. This is a respiratory illness that infects the lungs. The best thing that you can do to prevent infection of your lungs is to cover and protect your airway and to prevent pathogen from coming out of your airway to cover your airway. So with that, I turn it back to you, Dr. Poor.
So this was pretty impressive to hear all the information from these experts. So just a few minutes for you before we start with question and answers in regards to a summary of what we are seeing in regards to COVID in our community. We actually this week, we exceeded 10,000 cases in our community. And we are now today at 10,192 cases. We have 99 new ones today that we are reporting. Last week, for the entire week, we had 926 cases with a positivity rate of 9.47%. We'll see what this week will bring at the end of Saturday night. Race and ethnicity, not a lot of changes. What we are seeing is that the switch is going on. There are more Caucasian white individuals who are infected, and we have less Hispanic, where the Hispanic percentage used to be 54%. It's now down to 42%, and it is decreasing. In our white Caucasian population, we were at 17% for a long time. We are now up at 31% and increasing as we go on. When we look at hospitalization, as of yesterday, actually, the data came in. We still have 249 med-surg beds available in this community for an occupancy rate of 82%. We have 85 ICU adult beds available, an occupancy rate of 76%. And we have 10 pediatric ICU beds available with a positivity rate of with an occupancy rate of 74%. As of yesterday, we have 94 patients in our area in the hospitals with COVID-19. We have only 4 COVID patients on ventilators, and that is a really low number, and that is very good. We are hearing from physicians that probably ventilators, compared to the beginning, are really only being used if there is no other possibility. In regards to death, we are reporting 134 deaths. 6 are going to be added today, and that may sound really alarming, but some of them actually have died in June, but it takes a while for death certificates to come in. On the other side, we not only are looking at cases, we also are making sure that our healthcare industry and healthcare institutions have the appropriate PPE. And up to now, we have distributed 3 million pieces of PPE in this community. Just on some miscellaneous items, there are now more than 20 sports teams in our community that have had cases in them. And depending on what we are finding out when we do investigations in these teams, sometimes only a few additional players need to be quarantined. Sometimes it is the whole team. So we are learning as we go around along, and actually also we can teach our coaches to really take the proper precaution, because it does make a difference. And I'm closing just with telling you a little bit about clusters that we are seeing in our community. Again, still construction companies are probably the largest number of clusters, but with the smallest amount of individuals. Wholesale retail is number 2, and long-term care facility clusters are number 3. Food handlers and restaurant workers are number 4, and quite different from the beginning, food processing and meat packing outbreaks are now number 5. At this time, I also do want to remind all the citizens of Douglas County, we are still in phase 3 of the DHM that the governor has put in effect. That is different from some of the counties that are planning to move into phase 4 tomorrow. But through discussions, we felt like with the cases that we are seeing in this community, and also with the potential opening of schools, we want to remain in phase 3. And so I think with all of this together, what you have heard today, we are trying to keep this community as safe as possible and this transmission under control, so that we can really open schools safely and can be around safe. So with that, I think we are going to open it up for questions, and it may be best if you bring your question forward to one individual, and then all the questions come to that, and then we move on to the next. So who would like to share? Yes, Joe.
The city of Lincoln has a mask mandate, arguably facing the same legal questions that Omaha would be facing. Why not issue a mandate and let the courts decide who's right?
Yeah, that's not quite true, Joe. Lincoln has a carve-out in the regulation. So Lincoln is handled different than Omaha, and that's why we cannot compare. You know, a lot of communities have different regulation, but Lincoln very specifically has a carve-out.
Did you consider putting that aside? Did you consider letting the courts decide in the end who's right and wrong on this?
Yes, I did. I did consider some court challenges. And you know, as health director, I have to say, my focus now needs to be on public health for this community and not to be caught up in potential court litigation. Also, I do want to tell you, I think we all want to have a united front in saying we all want the same thing for this community. And that's really my message today. Hopefully, everybody in our community, I know some people are going to be disappointed, and I'm disappointed too. You heard it from some of our experts too. But we can do this. We can do this without a mandate, and hopefully the information you receive today is going to lead everyone in that direction.
Dr. So we can understand, can you walk us through the legal disagreement, what was said, and why did you come to this decision?
I don't want to go really into the legal decisions. I can just tell you from my perspective, not my perspective, what has happened is there was legal disagreement because between the Attorney General's office and the city attorneys of Omaha in regards to the authority of the local health director to implement a mask mandate for the city of Omaha.
Was this something that was medical, or was this a political decision?
There was a legal decision.
How much did politics play in that legal decision?
Why don't lawyers here that do explain that part? You have plenty of doctors who talk about wearing masks, you know, and we've been told to wear masks for months. What makes you think anything's going to change without a legal mandate?
I do hope that things are going to change, and I actually have heard yesterday from some people that they are feeling people are taking it more serious. I think everybody knows that the transmission in this community is going to depend on if we can open schools safely and keep schools open. So I hope that's another question to the community, and therefore they will do the right thing.
Dr. Poor, after your presentation to the Board of Health, did the governor call you? Did he put pressure on you? And did that change your mind?
I rather would not, but it was in the last 72 hours that those disagreements occurred.
Did you hear from the governor, or did he put pressure on you to?
It was during the last 72 hours that these legal discussions occurred.
I mean, we've heard from you before, and we've heard from the governor saying, well, it's up to the locals, and you're saying, we need help, and this is what we want to do. So why is there such a disagreement? And Dr. Rupp said political threats. So I guess what's happening here?
I'm just going to leave it at that. Legal disagreement, and there always can be legal disagreement. I understand that completely, but that's what it is about. And I think we still have a way to move forward potentially with the city council. And so let's. Yes, sure.
Yeah, I'd like to make a comment on that. I get my authority from the city charter and municipal code, and so does Dr. Poor. Chapter 24 of our municipal code does say that in times of epidemics and pandemics, Dr. Poor becomes the city of Omaha's public health director and has authority to make orders for the health and safety of the citizens of Omaha. I will tell you this, our law department feels like we are on solid ground in the city of Omaha if Dr. Poor wanted to make a rule or an order. However, the Attorney General's office did not agree with that. And they felt like state law trumped what we had in city code. So that was basically the issue. And so to avoid controversy, and again, I think Dr. Poor is making very, very good, wise decisions. You've heard from these experts that are here today, Dr. Niemann, Dr. Lowe, and Dr. Rupp, how important it is. It just baffles me right now when you hear these experts talk, and we have been saying this from the beginning, why there is still even any debate on mask wearing. I've said from the beginning, I hope everybody just does it, and they should be doing it. But we put a post up on social media a couple days ago and just explained about masks, who has the authority to do that. The governor does, or the Department of DHHS and Dr. Antone, he does, and Dr. Poor does. She has the ability to make DHMs. I do not. As mayor of Omaha, I don't have that authority. But we had over 850 comments on that one post of people arguing back and forth about the value of masks, about that it's not of any value. I don't even understand why these arguments are happening. I mean, you're getting the best advice in the world right here in Omaha. We should be wearing them. In my opinion, it doesn't need to be a law. The one thing that I hesitated about with it being a law is that would mean if you were out in public without a mask, you are committing a crime, and you could be arrested, and the city prosecutor would prosecute you. And that does concern me, because my police department has a lot of work on their hands right now, but to be going out and arresting people for not wearing a mask. But why they're not wearing it, that's what baffles me. We all should be wearing it all the time, and that's what we are asking today. So I don't feel like it was a political issue at all, whether this was legally correct or not. I don't feel it was that way, but I do feel like that there was disagreement from my city law department and the Attorney General's office whether Dr. Poor had that authority. But again, I'm going to say, our law department understands our city charter and they understand our city code, and they did feel like we were on solid ground.
Then to Joe's question, why not let the courts decide?
Well, why do we want it tied up in a court battle right
Because
now?
they've tied up in a court battle for a number of weeks or whatever. People are wearing masks and they're save lives, are they not?
Tom, a court battle could take years.
Good. And if people are wearing masks, they're not to save lives,
But
right?
we need action now. And it may. I mean, it may. That they may challenge it, what is in our city code. It may end up in a court battle. But we don't have time for a court battle. Like we said earlier, we should have been wearing masks, everybody, weeks and weeks ago. So we need action right now. And if it ends up in court, it ends up in court. And maybe that's a good thing, to find out what that really means and what authority Dr. Poor actually has and what authority I have. But at this time, we don't want to wait for a court battle. We want action now, and action now is what's important.
Mayor, you felt no pressure from Governor Ricketts, no pressure at all?
No, I did not.
So why, if this is a local, if this, this has been on states or on local departments to do their own thing, why, maybe this is a question for Dr. Antone, why not let that local control take effect here? Why would the AG's office disagree?
Why? I mean, again, they are looking at what is in state statute and they are looking at what is in our city code. And I'm not a lawyer and I'm not going to debate the legality of it. I'm just here to really stress the importance of wearing a mask, one way or another. I think that's what's really very important right now. Dr. Antone, did you want another question, Michelle?
Well, I was just gonna say the AG's office doesn't agree with what Lincoln's doing, and they're not doing anything to stop them, so why don't we just push the issue to save lives?
But again, Lincoln has a different form of government, and they can do what they are doing. You know, the health director for Lancaster County is hired by the mayor and reports directly to the mayor. Dr. Poor does not do that. She reports, I mean, she's a Douglas County health director, but in times of pandemics, epidemics, she becomes, our public health issues, she becomes ours. This hasn't happened that often. You know, we haven't had to deal with this. In fact, I don't ever remember when we've had to deal with something like this. This is very unique, and we're trying our best to help everybody navigate through it with the best advice we can possibly have from the experts. So again, I'm gonna put a resolution on the city council agenda. It should send a very, very strong message that if I have the backing of all 7 city council members, the city council can make it a law, but it's gonna take a while. All of these things take a while. I even checked into could they do an emergency ordinance. And yes, they could do an emergency ordinance and waive the public hearing and waive the 15-day wait after it's passed to become effective, but it takes 6 votes of the city council to pass an emergency ordinance. And I'm not sure we have the 6 votes.
Mayor, if you said that you don't feel that this is political, you have 1, 2, 3, 4, 5 doctors, came up here with a mask, and you take your mask off, and you're the politically elected person that takes the mask off. How do you explain that the visual? People say that when you say this is not political, but you're the only politically elected person here who takes their mask off when you come up to the podium.
I take it off so that I can speak clear. I've done it on every press conference, and I'm sure you've been at all of my press conferences.
But they all speak clear. I heard we all heard Dr. Antone,
okay.
we heard Dr. Rupp.
It was just a choice of mine, that I take it off when I'm speaking. I'm 6 feet away from you. I take it off when I'm speaking, and I wear it all other times. And I wear it in public all the time.
Mayor, I heard from another reliable source that you've come to an agreement, at least in terms with the state, for CARES Act money. Is this connected at all?
No, and we have not come to an agreement with the state. We've not come to an agreement with Douglas County yet either. There's no formal agreement on either.
There was no problem, like an agreement in principle?
No.
Not even an agreement in principle?
No.
So this is not connected with CARES Act money at all?
No, it does not. There was no threat to me at all. Again, this was not, I don't have the authority to make a mandate. We felt like Dr. Poor did, but it has nothing to do with the CARES Act money, nothing.
Mayor, in a state that prides itself on local control, from school boards to natural resources district, why punt this back to the state? Why not fight it out?
Again, Joe, I don't know what you mean by punting it back to the
Really,
state.
letting the state make the decision.
But it is a legal issue, is what we are dealing with. That's the issue, and we need action now. We need action 3 or 4 weeks ago.
But Dr. Ford says she can't worry about the legal issues. She has to worry about the health issues.
Yes,
so
she does.
And
she does a very good job at it
so
too.
then why not just, let the lawyer sort it out? I'm gonna make my decision and let the lawyer sort it out.
I'll let Dr. Poor answer that. I don't want to speak for her.
Dr. Ford?
I thought about this long and hard, and that's a decision that I made, that I really need to, I'm focusing on public health at this time. I'm not a lawyer, I'm not getting in the middle of all of this. I felt like that's what the community needs me for at this time. And therefore this controversy this disagreement wasn't really something that I wanted to get involved with. Now, that does not mean that potentially in the future I could change my mind.
But what did the science say? What does the science say we should be doing right now?
The science said all the entire community should wear masks. That's what the science says.
Realistically, how are you gonna change any minds? I mean, it's like we've said here, it's divisive, it's political, it's people showed up at that Board of Health meeting where they were asked to wear masks, and there were people sitting there not wearing masks. So it's awesome that we have all these experts here, but how are you gonna change this mind? Your 850 comments back and forth. How do we change the people's minds who refuse to wear a mask because it's their right not to wear one?
So I think, Michelle, you are absolutely right. This is going to be difficult. However, I do think strong communication over and over makes a change of behaviors. And what I would say today, and I probably have never said that before, if people feel very strong that they do not want to wear a mask, then social distancing is the other thing that is really important. And I would say those individuals do not go into indoor spaces where there are a lot of people around. Because what they are doing, they are endangering then others in that community. And so that's what everybody has their right and their liberty to do. However, based on, again, what we heard today, I hope it makes people think twice and say, I probably should listen what those medical experts are saying. I probably do want to have my grandchildren or my children go back to school. And this is the time where I should change. And this is not difficult to wear a mask.
Dr. Poor, there's a lot of confusion as it is already with this virus. Dr. Fauci first said don't wear a mask, then wear a mask, and people are confused. Anyway, last week you pretty much seemed adamant that we would be announcing a mandate this week. Doesn't this add to the confusion? Did you speak prematurely last week without doing the proper research? What really happened? What changed?
I said last week, I said if I have the authority, I will do it. I said two things are going to drive me: the cases, the transmission in our community, plus me having the authority. So this did not come up until 72 hours ago.
And in those 72 hours, what? We heard from the Attorney General?
Yes.
I had a question for Dr. Rupp. Dr. Rupp, in order to, I don't know what the phrase would be, flatten the curve or whatever, to lower the rate, to lower the spread, how much in compliance do you need in a community? Let's say like you had 10 people, how many people of those 10 people need to wear masks in order to bring numbers down?
Well, that's just an example of one of the things that we don't fully understand. And as has been pointed out, some of the guidance has changed over time, and I think that that's part of the confusion that we have in the community and why some people are not accepting wearing a mask as a reasonable measure. And I think that really this is, rather than a sign of incompetence, it's actually a sign of our public health officials doing exactly what they should be doing, which is getting the best data possible at the time and then offering the best guidance that can be offered at the time. And as everyone knows, we did not know about this infection 6 months ago. This is totally new. When it came out, the role of asymptomatic and pre-symptomatic shedding of the virus and the potential transmission via that route was really undescribed. And therefore, initially, public health officials felt that wearing masks in public was probably not worth the effort involved with that. As the information has evolved, and it has become quite evident that a sizable proportion, again, you can argue the numbers, but it's certainly a significant portion of transmission occurs from those people who don't know that they're sick. And so if we just simply say, stay home when you have a flu-like illness, we're not going to be addressing those other folks who are out in the community potentially shedding virus before they get sick, or perhaps they have a very mild case or even an asymptomatic case. So this is a very long-winded answer to your question. I don't know the proportion, but I think it has to be very, very high in order for this to have the desired effect.
Could you elaborate on your statement about political threats?
Oh, I don't know anything. I don't have any insider information on that. I know what you guys put into the media, quite frankly. I know that when the announcement was made in Lincoln, Lancaster County, that the media reported that the governor's office was considering legal challenge. That's really all I know.
And you said you're frustrated with that, so can you explain that more as, you know, our infectious disease expert here known across the world about how frustrating it is to watch this unfold?
It is very frustrating, and it's very fatiguing for medical professionals to be dealing with this for month after month. We know what we need to do in order to prevent the transmission of this illness. We have the tools, and we have the capability of doing this. We are not in the black ages, you know, the dark ages, where we thought this disease was spread by, you know, evil humans. We know that this is spread person to person via respiratory droplets and aerosolization. We have the capability of distancing physically, wearing masks whenever we're in any sort of a shared indoor airspace, and really crimp down on the transmission of this. This is not a mystery. So I do have frustrations when we're not putting into effect these measures that will and have demonstrated the capability of decreasing transmission. Absolutely, it's frustrating.
Dr. Poor, could I bring you back to the podium for a second? I'm wondering if there's a number on the positivity rate, for instance, which you would look at and say, okay, now it's time for the mandate, no matter what. Legal disputes or not.
You know, it's probably not so much a number, it's more a trend, I would say. So just one number is probably not going to make a difference. It's a trend. We would see over 2 weeks, we would see hospital utilization, we would see death, we would see a positivity rate. A high positivity rate is really an indication that there are potentially more individuals in this community who are affected but are not getting tested. So I would look at all of these things together. It's not one number.
So it's possible you could revisit this decision.
It is possible, yes.
Mayor, from texts I'm getting and comments that I'm getting, it doesn't appear that this is passing the smell test for a lot of people. I just got this from a high-ranking educator in the city. It says, this will lead to schools closing. Why can't they stand up to the governor? Lincoln called his bluff. How would you answer that? How do you respond to that?
Well, first of all, I would say, again, that I think everybody recognizes the value of wearing a mask. I like what I am seeing all over Omaha right now. I like when I go into a retail store or a grocery store and it says, all are required to wear masks. I like when I have been talking to the area superintendents, talk to Dr. Logan very frequently, as well as all the other superintendents. And I like that they've taken that strong position and said all of our students will wear masks. You know, Dr. Logan has 54,000 students in OPS, bought 5 masks for every student. And she is getting every day controversy from some parents saying my child will go to school, but they will not wear a mask. So, you know, it isn't accepted by everyone yet, and it should be, and that's what baffles me.
Well, wouldn't a mandate then force those kids to wear a mask?
Well, they are in school anyway. And like I said, a lot of stores, a lot of retail, a lot of big box stores are saying, you don't wear a mask, you don't come in. I like what I'm seeing there. They're taking that responsibility on themselves. You know, some of these stores, I've talked to their corporate offices and their vice presidents of their company, and they're making these decisions, you know, countrywide. And these are good decisions because people recognize the value of it. But we still don't have everyone on board, and that's what really concerns me and bothers me in Omaha. You know, I got into a situation waiting in line at Home Depot like everybody else, 6 feet apart, and there was a person behind me without a mask and a person in front of me, a whole family, they all had masks on, and I had my mask on. And here I'm in the middle, and they got into an argument with me just standing in line. And you know, the one without a mask was calling me a communist, and taking away rights. I mean, this is still very controversial in our community, and it shouldn't be. It should be about public health and safety and controlling the spread of coronavirus. Everybody knows it's here, it's deadly. There is currently no treatment for it. There's currently no vaccine for it. So we have to do what we can do and be responsible, whether it's mandated or not. We need to be responsible, and that's what you're hearing from every one of us today.
But Mayor, what does today's decision mean for those people who don't want to wear a mask? I'm thinking this, they'll think that they got the green light now, they don't have to wear them in stores, they don't have to wear them anywhere because there's no mandate.
And stores
But-
frankly don't.
But you know what, John, even, I talk to the mayor of Lincoln all the time, and even in Lincoln, they're still having issues. You know, she made it very clear that she didn't want the police out giving citations out. She wanted it to be a teaching lesson. She wanted the police to be giving masks out instead of giving citations out. But those who don't wanna wear a mask, it's not because they don't have a mask, it's not because they can't find a mask, it's because they, for some reason, don't wanna wear a mask. And so she's still dealing with some of the same issues she has before. Now, it's a little too early to tell, because they think her mandate's only been in place for a week and a half now, maybe, but, you know, they're not seeing any change in their numbers yet, or their hospitalizations, or their positivity rate. But I think Dr. Poor would agree it's a little early for that, since it's only been in place for a week and a half.
But you can see those people saying, yay, we won.
I don't think so, John. I mean, I'm not feeling like they've won.
Have you read
You don't get my
everyone's
email,
comments?
Hey, you don't get my email either, I'm telling you. I mean, I hear it from everybody all day long, literally probably 1,000 a day. And everybody's got their opinion on it. But I don't think it's to the point now, it shouldn't be an opinion. It's a fact, it's a need. And you're hearing it from these experts today, and you're hearing it from me. We need to be wearing masks in public all the time. Now, another thing though, keep in mind that the Lincoln ordinance has a lot of exceptions, and you don't have to wear a mask if you're in a restaurant eating, and you don't have to wear a mask if you're in a bar drinking, and it's very much for inside public places where the public gathers. You don't have to wear one outside. So there are exceptions. So it's not that suddenly every single person in Lincoln is wearing a mask all the time. We still struggle with it. She's still struggling with it. So our best advice, our best message we could possibly give out today is it is important to wear a mask whether there's a mandate, a law, or not. Everybody should be wearing one. That's what's important.
Do you think, Mayor, though, that by saying that with all these doctors here, that you can get 500,000 people in the city of Omaha to comply?
Gee, I hope so.
So we're going on a hope?
And that, no, well, not going on a hope, we're saying we're giving you the best advice we can give you, and we hope you all listen to us.
Mayor, can I ask you a couple of CARES Act money questions that Tom kind of brought up a second ago?
Well, let's finish
Okay,
this
okay.
first, and then you can ask me.
Thank you.
Any more questions?
I do for Dr. Anton from Andrew Ozaki. Do we have enough information to determine what percentage of the population in Nebraska has the virus or have the virus?
So we keep track of those numbers. The question is what numbers might we have to see how many people in Nebraska have had the virus? So we've tested, I think, had a positive test now for 1.3% of the population of Nebraska testing positive. Most of the experts that comment on that say you multiply that percent positive of your population by 10, and that's probably the best estimate for the number of people in Nebraska that have had the virus. So around 13% of Nebraskans have probably had the virus and known about it or not known about it.
Okay, and then it says, do you have any idea the percentage of Nebraskans who have now been tested? How many multiple times, and how many multiple positive tests for the same person?
I don't have that answer in front of me right now as far as how many people have been tested multiple times or multiple positive. I just know as of last night, we had 271,245 people tested in the state of Nebraska.
And can we know how many of those are positive or negative?
Yes, it's 25,776 are positive. The rest therefore would be negative.
Are those 271,000 separate people, or is it people that could have got tested more?
Those are individuals. As far as wearing a mask,
Yeah.
I wore a mask for 80% of my adult awake time, so I don't mind wearing a mask. As a
Most people are
surgeon in
tested,
the past.
are they showing symptoms? So in other words, that 10% roughly that are testing positive, are these people that are already showing symptoms, or is this just random people on the street, you know, 1 out of 10 has the virus?
It can be both. We don't know
Well, I
that.
mean, as far as statistically.
We
what
don't
do you
know
look
the
at? You don't
statistics
know?
on that of how many were asymptomatic.
Dr. Poor gave us a breakdown last week of by at least 5-year increments on young people having the virus. Does the state have any breakdown below 19? I know it just goes from 0 to 19. As school gets closer to starting, do we have any idea how much transmission is going between those young people, and how that breaks down by age group? How many of those young people are, where they're getting it, who they're spreading it to? Any results from daycares?
Sure, those numbers as far as the breakdown on age groups and the positivity by age groups are all on our dashboard.
Well, it goes from 0 to 19, unless it's changed in the last few days. It goes from 0 to 19 that I've seen.
0 to 19 and then 19 to 34.
Right. Do we have anything lower so we can see what kids
Not to
are
my
getting
knowledge,
it?
we don't have anything lower, but if there is a trend, and Dr. Poor is so smart to say, well, we'll follow the trends. That's what we follow every day. I mean, we see what's trending, and there's no doubt there's a trend in the lower age groups now. The 19 to 34 age group is where the test positivity rate is going up the highest.
Thank you.
You got a question about CARES Act?
A couple, Mayor. The county board, it might have been Commissioner Boyle, but they talked about having a hold harmless position with the city.
Yes.
So if the city gets X number of dollars and a couple of years goes by and the federal government says that was misspent, the city would have to pay it back. You okay with that?
Yes, absolutely. In fact, I offered that. I talked to my law department, probably a couple months ago, and said, can we write up an agreement with the state of Nebraska and also Douglas County that if they give us and award us CARES Act money, and later on we are audited by the U.S. Treasury Department and they find that some of our expenses weren't eligible, we would hold the state of Nebraska and Douglas County harmless. So we would indemnify them, and we would cover anything that was paid out that they found was not eligible expenses. So yes, that was something that I recommended, and our law department said yes, that could be done.
And you also said that there's no agreement yet with the county.
That is correct.
But the county board and a couple of their officials earlier this week said all they're waiting for from the city to give some $25 million is some written report, and they're wondering where it's at.
It's been submitted.
So the county's got this backwards.
It's a little confusing because we don't submit directly to the county and directly to the state of Nebraska. What the governor asked, which we are doing for the state, is that there is some FEMA money available, and according to FEMA, their guidelines, it looks like the city of Omaha's eligible expenses could be less than $1 million, maybe $600,000–700,000. It was a very long, tedious process that we had to submit to FEMA. We actually had to ask them permission in March to submit, and then we waited until just a few weeks ago for them to give us permission to submit. So we have submitted to FEMA, and we are waiting on a result from FEMA. As far as Douglas County goes, they are using Deloitte as well as the state of Nebraska to help distribute the money. Douglas County has asked us to submit to Deloitte first, so that Deloitte could go through what our submissions were, and then they will basically make recommendations to Douglas County if our expenses that we submitted are eligible or not. We have done that. But these are all very long processes. Now, I have talked to Commissioner Boyle and I've talked to Claire Duda just recently, and we are questioning whether we really need to wait until we get those results from FEMA, because we know what our eligible expenses are. So just subtract $600,000. So, the city of Omaha needs about $60 million to make ourselves whole. That's what we need. And that's what we have determined our eligible expenses are. And so we are using the U.S. Treasury's guidelines. And with the U.S. Treasury's guidelines, they are broad enough that we feel like everything we carefully submitted are eligible expenses. But as of right now, we do not have a formal agreement yet with the state or with Douglas County.
So whatever report the county says the city needs to submit, you're saying it's already been submitted?
Whatever they need, whatever the state of Nebraska needs and whatever Douglas County needs, we will get to them. I mean, my finance department now, that's about all they're doing. Now that the budget has been submitted to the city council, they're working on getting these things submitted. These are not easy things to do. I mean, with FEMA, they had to have their portal open up before we could even submit. It's a long, tedious process. But the bottom line is, We can't wait much longer. I told both Douglas County and the state of Nebraska I needed to know by the end of June, because I have to make some really serious decisions of how I'm gonna keep the city up and running. And so I need an answer, and it's critical that I get an answer now.
It appears that the right hand of government doesn't know what the left hand of government is doing.
Well, you know what, that's the understatement of the year, I guess. I mean, we've never dealt with this before, Joe. I mean, you know, this money, this CARES Act money came directly from the US Department of the Treasury. They put it in bank accounts, and then they came back later and said, here's how you can use it. When they deposited the money, there weren't any rules of how you could use it. And then they have come out with guidelines, and they have come out with FAQs, and you know, and it's very, very complicated. But the bottom line is, the state has received $1.25 billion of CARES Act funding. City of Omaha is going to be in big trouble if we don't get some of those expenses reimbursed.
Are you more optimistic about getting that money now than you might have been a week or two ago?
I'm always trying to be optimistic, Tom.
That wasn't the question.
Am I more optimistic than I was a week ago? I will say yes. I am more optimistic, but until I see it and I see the formal agreement, there is nothing I can do. I mean, I've already reduced expenses as much as I can. As you know, libraries are closed, swimming pools are closed, community centers are closed. We have a hiring freeze, we have a purchasing freeze. I asked the fire and police department to reduce all of their overtime. And what happened with the protests? You know, we have $2.5 million of police overtime that I have to pay. So it's very dynamic too. It changes day by day. But we have calculated very carefully, our finance department, that we feel like we have about $60 million in eligible expenses. And right now we are about $60 million in the hole. And that's a $420 million general fund budget. So that's a big chunk of change that it's my responsibility, have to figure out how we're gonna navigate through this and balance it out by the end of the year.
Is it time to make those tough decisions on layoffs?
It will be soon. I can't wait too much longer, because I can't wait till the end of the year and try to balance it out. I've gotta figure it out now. And you know, there's a lot of expenses that both the county and the state have already approved. But you know, I've got people, I've got full-time positions here, and my job is to make sure city services are delivered. And I you know, taking people out of the public works department or the planning department or the fire department or the police department is not gonna be good for the city of Omaha. It is not, I can guarantee you that.
And Mayor, the CARES Act money from the state and the state's position that Omaha shouldn't enact a mandate, there's no ties there at all?
What was that again?
The fact that the CARES Act money you would
Oh, the
get
CARES Act money and the mask mandate? No, there was not any connection in that at all. There was no threat to me at all that if there was a mask mandate that we wouldn't get any CARES Act money. That did not happen.
Okay, I think we are gonna close this out now, and again, I hope you can get the message out, how important it is, what you have heard today from all these experts, and how important it is for everyone in our community to follow that, and hopefully follow it because the science is here to follow. Thank you all for coming.